All right, so I have noon on my end, so we're going to go ahead and get started. Good afternoon, everyone, and welcome to today's virtual congressional briefing. My name is Tyler Smith, and I'm the Senior Director of Government Relations for the PA Education Association, and I'm grateful to have you all join us today. I wanted to begin this afternoon session with just a few housekeeping points before we go ahead and get started. At the top of the screen, you have viewing options that allow you to exit full screen view and see side-by-side views if you'd prefer. If you have questions at any point during the presentation today, please go ahead and submit them in the designated Q&A box below, and we'll plan on answering them at the end of our presentations. With that, I'm pleased to hand it over to Nicole Burwell, PAEA's president, for her opening remarks for today's session.
Thank you, Tyler, and good afternoon, everyone. As Tyler mentioned, my name is Dr. Nicole Burwell, and I'm bringing you greetings this afternoon, I guess it is, as the president of the PA Education Association. And I also serve as the department chair and founding program director for the Developing North Carolina A&T State University Physician Assistant Program. And so it's my privilege to be here today. I'm honored to welcome you all to today's virtual congressional briefing entitled Building a Healthy Future and Why Federal Student Aid is Critical to Growing the Healthcare Workforce. As I reflected on the importance of today's session, the ongoing challenges in ensuring access to high-quality care and a robust and well-prepared healthcare workforce cannot be overstated. Federal student aid, such as the Grad Plus loans, among other financing options, play a pivotal role in expanding access to health professions education programs for thousands of students across the country. According to PAEA's most recent student survey, over 85% of our students rely on federal student loans to complete their programs and be able to enter the workforce. And this metric underscores the importance of how federal funding for higher education directly impacts the future of our healthcare delivery system. This is just one indicator of how the future of healthcare is inextricably linked to the availability and the access of federal funding for higher education. The healthcare and higher education landscapes are constantly evolving and changing. New challenges and opportunities are always presenting themselves alike. Healthcare is becoming more complex as patients are living longer with chronic illnesses and multiple comorbidities. As we try to navigate these challenges, it is imperative that we not only recognize the important role of federal student aid, but also work collaboratively to enhance and expand these vital resources. Today's briefing provides a unique opportunity to learn more about the impact of federal student aid programs and the actions that Congress can take to help bolster our future health professions workforce. I'm excited. We have three esteemed panelists who each will provide their own unique perspectives on these issues. This afternoon, I'm pleased to extend a warm welcome to our first guest, PA Frank Gianelli, an assistant professor at the Rutgers University PA program. We also have with us today Jacob Jin, a student at the Rosalind Franklin University PA program and a PAEA Student Health Policy Fellow. And also Dr. Edward Williams, the program director of the University of Arkansas for Medical Sciences PA program. Dr. Edward Williams also serves as the chair of PAEA's Government Relations Steering Committee. In closing, I offer my deepest gratitude to each of our esteemed panelists for your attendance at today's session. I'm extremely grateful for your passion around this important topic and for helping us to advance this work today. By working together, we can ensure that federal student aid continues to serve as a cornerstone of healthcare workforce development, helping us to achieve better health for all now and in the years to come. With that, I will hand it over to Professor Frank Gianelli to begin our session today. Thank you.
Thank you very much, Dr. Burwell. I'll just start real quick by introducing myself and sharing a little bit about my background, and in order to help shape the lens by which I'm approaching my my role today on the panel. So in my current role as a faculty member, I get to think about students and student aid all the time. This is a common conversation that comes up when I'm talking to students, and sort of how their minds work in terms of the impact that this has on their current experience as students, as well as how it's going to shape the future. But I also approach this conversation as a practicing PA. I've been a PA for 11 years now. And before joining Rutgers in higher education, I was a member of the National Health Service Corps and worked in community medicine, and know very well how student debt and loans can shape career choices, as well as how the role of federal aid in a various number of ways that I'll discuss during this panel can help shape the future of our workforce as well. So that's kind of the perspective that I'm going to take as we sort of walk through this conversation. Tyler? So I thought I would start by sharing a recent conversation that I had with one of my students. Annually, we have these formal sit downs with our students where we get to do these check-ins. And the check-ins each semester, we talk about things like their grades, professional development, study strategies, all the kind of things that people think of when they think of what do academic professors talk to with their students. And I almost always start the conversation with, what's making you worried about this semester? And usually, like I said, I expect something like, I want to learn how to study better, I want to get that B, or I want to get up to an A, or whatever it might be. But increasingly, what I'm hearing is, I'm worried about paying my rent. I'm worried about getting food. And this is concerning to me, because the biggest stressor that a student should have is, how do they improve their academic performance, and how do they become the better PA that we all want them to be? And so what this tells me is that there's a problem with the way students are getting their financial aid, and what options they have. And that has become a priority, and not the priority of becoming the PA that we all want them to be. So, as was introduced by Dr. Burwell, student loans are a must for the majority of PA students. PA students on average borrow $108,000 for their PA student experience alone, not including undergraduates, gap years, prerequisites, whatever it might be. And nearly all, 85% of our students have some degree of loans. But the story doesn't end there, which is to say that loans are a big deal, because not all loans are created equal. There are different interest rates, there's different repayment options, there's different structures in which the loans are accumulated by. And the way in which these inequities amongst the different loans can very much so not only shape what fields our students are going to once they graduate, but also can shape who is entering into medicine to begin with. Tyler? So when we think about the current borrowing options for our students, there are three big buckets that they fall under. The first are unsubsidized Stafford loans, the second are Grad Plus loans, and the third are private loans. Unsubsidized Stafford loans are federal loans that have interests that start to accumulate while the borrower is in school. Grad Plus loans are additional federal loan options that help to fill the gap between what is set by the institution as the cost of attendance and other federal loan options. The biggest problem that comes in here is that they have higher interest rates than unsubsidized loans, and there's sort of this cap borrowing that's determined by the schools in terms of what the overall cost of attendance might be. And then there's the third bucket, right, which is the private loan bucket. And these are given by private lenders like banks, with often higher interest rates than what happen at the federal level, and in many times varying interest rates depending on how things are going in the economy. And they aren't eligible for participation in some of the federal loan assistance programs that we'll introduce throughout this presentation. And so two opportunities that myself and Dr. Williams will introduce throughout the rest of this presentation and talk about are the subsidized Stafford loans for graduate students, and then higher borrowing limits on unsubsidized Stafford loans for students. So in terms of subsidized Stafford loans, as was mentioned, this is a federal loan that is needs-based. And one of the key features that are a part of the subsidized loans programs that aren't a part of the unsubsidized loans is that there's no interest that accrues while the student's in school. But the limitation right now for our students, our PA students, is that subsidized Stafford loans are not currently available to graduate or professional students. And this is not simply limited to PAs, but other high demand medical fields such as social workers, psychologists, physicians, and nurse practitioners. So what's the big deal? Like, why even bring this up, right? And so what I did was I created a hypothetical scenario, which is based on what the average PA student will need to borrow. And so if we're saying that the hypothetical PA student borrows $100,000 to cover their cost of attendance at school at a 7% interest rate, which is the current subsidized and unsubsidized Stafford loan rate, and for the average 27-month program, what we see is that in both cases, the loans come due 6 months after graduation. But in the current borrowing option, which is the unsubsidized student loan option, by the time the student has graduated, they've already accumulated $21,000 in interest because of the current accumulating interest while they're in school. And by contrast, in the unsubsidized program, they start to pay at $100,000, the exact amount that they borrowed from. And so we could see the big difference in where your compounding interest starts once they graduate from school. So this is where the call for increased borrowing limits for unsubsidized loans comes in. So right now, PA students are capped at the graduate student level of $20,000 and $20,500 per year. But this is not on par with other health profession colleagues. When we look at who can borrow what, there's a range depending on the type of field that you're in and the type of specialty that you're going to have. And for other colleagues of ours, physicians included, this rate is almost double. And so what we can see is that by increasing the unsubsidized loan amounts, we can increase access to loans at a lower amount. Tyler? When we talk about Grad Plus loans, this is the second borrowing option that we had mentioned earlier on, which is that Grad Plus loans are intended to reduce dependence on private loans to fill borrowing gaps. And the interest rate right now for Grad Plus loans are fixed at 8%. And again, they're federal loans. But when costs exceed what Grad Plus will cover, that's where the private loans come in. And we've sort of talked about some of the limitations of private loans throughout the entire the beginning of the presentation. Repayment may start in school. Interest rates may be varied depending on the type of loan it is. They may be fixed, but at a higher rate than what the federal rates are. In the range of federal loan repayment options, we see that they're not included in the repayment programs, and private loans are often not capped, and so there can be very large borrowing. So the continued support of Grad Plus programming, in addition to increase in unsubsidized loans at the very least, can help decrease the dependence on private loans for our students, such as the one I mentioned earlier on, that is now concerned about how to pay rent when their costs exceed what it is that they're sort of allowed to borrow through these different programs. So oftentimes when folks think about debt, they often think about it as, well, it's a personal problem to the individual who's deciding to borrow. But debt has unintended structural problems, right? And it has consequences for not just the individual, but for how our workforce is shaped, as well as the types of specialties that our students will go into. So we know that debt shapes who can enter the workforce. Folks who have to take out more loans are less likely to pursue graduate education than folks who have to take out less loans. And in particular, when folks have to depend on higher interest rate options, such as private loans, it makes it so that it's less appealing to go into fields such as PA and other medical fields where we have needs to borrow for high cost of attendance. The second thing that it also does is it unintentionally influences specialty selection. There's ample data out there that support that when folks graduate with higher debt, even if their best of intention is to work in places like primary care, in rural urban settings, pediatrics, OBGYN, they simply don't when they're faced with the reality of their debt and the higher paying specialties that will help to relieve that debt quicker. And so I know many of us on this webinar have shared interest in increasing access to healthcare services, improving equitable access, particularly in our rural and urban communities. That's a challenge when debt is a factor. Tyler? And so, as I mentioned earlier on, this is not something I speak of just as an academic, but from a personal perspective. When we talk about options for our students, any option to discuss debt relief has to come in a conversation with the National Service Corps, particularly if we want to think about the relationship between individual debt and our structural needs as a society. And so the National Service Corps, for folks who aren't familiar, is a program that helps to match folks who want to work in underserved communities and primary care settings. And in exchange for working in those areas, helps to relieve the financial debt associated with going to school to help reduce that barrier to entering into practice in these spaces. And so when we think about our structural debt problem and our cost of attendance problem that Dr. Burwell outlined earlier on in her opening remarks, increasing mandatory funding for the National Service Corps is innately tied to this, particularly when we want to think about debt and structure and society. And then finally, I'll mention a little bit more about public service loan forgiveness because this ties into this entire conversation as well. Public service loan forgiveness happens when we have forgiveness of outstanding federal loan balances after 10 years of public service and payments. There's ample data out there that supports that the public service loan forgiveness programs incentivize PA graduates to practice in underserved and nonprofit clinical settings and or to enter into academia and other nonprofit institutions. And so when we think about increasing the amount of federal loan options for students, this is important because the dependence on private loans doesn't allow this type of forgiveness to take place. And that concludes my remarks, and I'll pass things over to our next panelist.
Thank you. Thank you for that information. I just want to introduce myself a bit. My name is Bo, but I go by Jacob. I'm a first-year PA student at Rosalind Franklin University. And I'm just talking about my journey to be a PA, how the graduate loan program has helped me to be where I'm at today right now. Next. Here's the kind of the content, the background I want to go through. I just kind of want to introduce myself a little further, how I got my interest in healthcare, what my background is, how the graduate program led me to be able to apply to PA school and be where I'm at right now. And then it's gonna kind of wrap it all up towards the end. Yeah, just a little bit about me. I'm a first year PA student, just as I mentioned earlier, at Rosalind Franklin University. I'm almost done with my first year didactic year, so I'm going to my clinical year in 2 weeks. So that's pretty exciting. And so I just a bit about my education background. I graduated from Cornell University, and then got my master's of public health at St. Louis University, and then now in my master's program for physician assistants. I come from a first generation of Vietnamese refugees. So my parents came here by boat actually, and they fled from the Vietnam War. And they landed in Baltimore, Maryland. And so when they came here to this country, they really did not know anything about this country. So it's like kind of, just where it was kind of thrown in the dark of where they were going to go. They didn't know the language or anything like that. So I kind of grew up where, both of my parents worked two full-time jobs. So because of that, like growing up, I didn't have a lot of hobbies or activities. So once I kind of graduated from college, I kind of discovered what my hobbies were. I'm a big avid hiker. I do a couple of photography, ran a couple of marathons. In the bottom, you'll see me with my marathon medal at Chicago and the Marine Corps at DC. And then like after graduate school, getting my MPH, my path to being a PA is pretty non-traditional. So I came from a healthcare consulting background, and then now I'm more towards like being a PA student and hopefully practicing as a PA in the future. Next. So how did I get, so you're kind of wondering like how did I get into wanting to be a PA practicing medicine, right? And so to be honest, like when I got to college, I just didn't know what to do. I know my options kind of were like, okay, medicine, lawyer, accountant, engineering, but I didn't know exactly what my, career options were or what I wanted to do since I had such limited exposure to um post what the job opportunities were for me. So I kind of explored a lot of courses throughout Cornell and just kind of took a lot of math courses, finance, and basic science courses as well. It wasn't until like I took a policy analysis course and where we kind of talk about kind of like the overview and the economics of the US healthcare system. And that kind of like opened my eyes to a lot of different things. Um, each topic that we talked about, it was kind of tapping into a lot of my lived experiences with the US healthcare system. So like I grew up with my dad, like having end-stage renal disease, growing up having Medicaid and having that difficulty of getting access to healthcare, even though I live in the inner city of Baltimore. So getting every time we were trying to make an appointment, it was always like 4 or 6 months out. And by that time, for my parents, it was always, a little too late. So a lot of that that course kind of opened my eyes that I wasn't the only one experiencing that. And so that gave me the interest of being more interested in healthcare. And so now I kind of chose so at that time I knew I wanted to be in healthcare, but I didn't know what my role was in healthcare. There's a lot of different paths. There's the medicine, the health policy. Do I want to do a PhD or go into public health? But because of that course that made me like so interested in healthcare and to be able to kind of solve some of these gaps in healthcare, in the healthcare system, I chose to, kind of be more in the policy realm. And that's where I started my career. So I graduated from St. Louis University and got my health policy analysis. And then after that, I kind of work in different industries within the healthcare system. Next. And so just a little bit about my background. After I graduated from St. Louis, I kind of worked in a health literacy organization where it's kind of like a nonprofit where we promoted health literacy strategies and plain language strategies in the realm of medical language and terminology, just to make it easier for patients to understand. And then I work in health insurance industry where I develop marketing strategies to provide Medicaid insurance to people who do not have Medicaid. And then I moved up into like the policy realm where I just kind of evaluate different policies and then work my way to consulting, where I did that for a couple of years, consulting for and solving problems that healthcare organizations and hospitals are facing, from operations to healthcare delivery to how to improve patient satisfaction within their healthcare systems. Um, and so I kind of did that through Accenture and DaVita. But one of the things I kind of realized as I kind of worked my way through solving different healthcare issues and being involved in different healthcare problems, one of the things I was missing for me was just kind of like that patient satisfaction or interaction that I really wanted. I mean, I have talked to in my consulting role, I talked to a lot of people, a lot of providers who just kind of love their jobs of just like, being with the patient and just kind of seeing that interaction, seeing that health spectrum from point A to point B that a patient had. That a patient goes through. That's something that I was kind of missing. Even though like a lot of the work I was doing was kind of more of the back end realm, it wasn't for me personally, it wasn't fulfilling enough. And so for quite a while, I kind of wanted to go in medicine, but there was that big barrier of like paying for the extra costs, paying for the extra courses that I have to go through, and paying for just kind of like figuring out my future financial situations when I was already well developed in my career as a healthcare consultant. So it was a real struggle for me for a couple of years of trying to like plan things out or just to see if that was feasible at all. But being in healthcare, I just kind of knew like, there's that big, huge gap of access of like where, my parents was not able to get that um, quick access when they were on Medicaid or Medicare. So it was something that was always dear to my heart to be able to kind of serve these kind of type of populations. If you go next slide, please. So I decided to kind of work my way through, just kind of make that jump. And hopefully things kind of work out towards the end. And so while kind of working, I kind of developed the patient care aspect, patient care experiences, and also taking additional classes that I needed to apply to PA school. It was a long and difficult journey, and at the same time, it was, a heavy financial burden on myself as well. Because I ended up leaving my previous career, which was a big decision for me. It was a very difficult one, kind of to work more closely at a patient level. So I worked at an emergency department. I worked at a cancer research center as well. And in addition, I had to take additional courses, which that haven't completely fulfill the requirement to apply to PA school at different colleges, from local community colleges to local in-state colleges. And once, that was, about 2 or 3 years um, of my time of like not having really any income at all to be able to just apply to PA school. And so you can imagine just the financial burden that I had to go through to be able to get just to apply to PA school. And once I got applied to PA school, I got accepted where I was in Franklin University, and that's where I'm at now. Next. And just to give you an idea of what I go through in PA school, I'm wrapping up my didactic year where we go through the anatomy of cadaver. So just kind of we do a full dissection of the anatomy, going through each muscle, each nerve, each major blood vessels with the cadaver, learning about the different pharmacotherapy and pharmacokinetics of different diseases that we go through. And we take pharmacy with the School of Pharmacy. So we just get that real in-depth knowledge partner with the School of Pharmacy students of learning how to prescribe different medication for different groups of people and what would be the best first line. In terms of like we take a general medicine course as well. And we just do a lot of physical exams, learning how to read EKGs, labs and imaging, and and we also learn about how to do a couple clinical procedures such as suturing, splinting, and intubations as well. And again, my future plans as being for a future PA is to go either in emergency medicine or critical care. And that is, and just as Frank has mentioned, I would love to do something where it would be at a non-academic, I'm sorry, would be at an academic center or a nonprofit hospital. So I can like kind of get that loan burden relief as well. Next. So again, just kind of to reiterate my path to PA, it just starts, even though I was I had a good stable job. In order for me to be a PA, it was a full-time commitment for me. And so, and that meant that I had to take out additional loans to be able to pay for courses, to pay for, um, to be able to get to the point to apply to PA school. And then once I got to PA school, I had to take out more loans and to be able to, pay for tuition, living expenses, books, and resources to help me succeed in PA school. So it was a huge financial burden for me. And I don't know if this option of like being able to take out federal graduate loans, I don't know if I would be here to as well. Next. And so just to wrap it up, like for me going to being a first generation refugee Vietnamese immigrant, where my parents never, they would never be able for me to go to college. So I had to rely heavily on these financial programs, especially the grad programs to be where I'm at today. If it wasn't for that, I wouldn't have chosen the path to be in medicine. Um, and because I've been in like healthcare for so long, I consider that kind of path to be in public service. And so, and I think that like being in public service, like that financial burden, it just, I feel like there should be some sort of incentive for people like me to be able to uh, do to be in that public service. And without that grad program and without the loan options, I would probably not be in healthcare at this moment. But because of this, because of the options that I could pay off my loans in the future with different programs, to be able to get that relief, that made this decision for me to quit my job to be where I'm at a bit easier for me. And that's all I have. Thank you.
Thank you, Mr. Jin, for that. I will take it from here and do the last section of this presentation with policy recommendations and a call to action. I am Dr. Edward Williams. I'm a PA, and I'm also the chair of the PAEA Government Relations Steering Committee. I do want to give you, before we go to the next slide, I want to give you a little bit of background on myself, as Dr. Gianelli and Mr. Jin did as well, just for context. I joined the Army back in 1991 when I was 18 years old. I was a medic for about 11 years, and then I got into PA school through the military, through IPAP. Did PA, was in the Army as a PA for about 10 years, deployed a couple of times during that time, and retired from the Army in 2013. When I got out, I worked in primary care in San Antonio, Texas for about 9 months, and then a position came open here at this new PA program that just started, and I became faculty in 2014 here, and in 2017 I took over as program director and chair. Now, the reason that I wanted to give you that bit of a background is because two things that I had a big eye-opening experience about when I got out of the military. One was that health insurance is complicated. It was something that I had to learn about and realize and understand how that applies to my patients. The other thing that I learned was how much debt students get into in order to get to where we are now as PAs. As Jen alluded to, there is a lot I had to really wrap my head around once I got into academia. And the more and more I realized that students' lives are really revolving around their economic ability to be able to afford school and then what they do financially once they graduate. And you've heard from Dr. Gianelli and also Mr. Jen about many different aspects of that and how that plays a role in what they do when they graduate and where they work when they graduate. So I will go through these last few slides and really just highlight what our call to action is and what we recommend that you help us to advocate for the PA profession. So the first one, policy recommendation is to restore access to subsidized loans. This restoring this access will also improve access to education for PA students, enhances opportunities for PAs who want to work in healthcare, like Mr. Jen, who had that real strong desire, and this helps them to be able to meet that goal. And it also is long-term benefits for PA diversity and retention in underserved areas. This allows for equity and enhancing the quality of healthcare. The diversity in our profession, it looks like many different things, not only from race, but also sex, gender, and where people come from, their social backgrounds and their experience. All of those things we as a program, and I know many other programs, find incredibly valuable because it helps those students to share their experiences, their background, their culture, and their differences. So when they do graduate, they're able to engage with people from their community or from other communities and understand some of the challenges that those communities face. So it's a key and important part of that diversity that I'll mention a few other times as we go through here. Our second ask is ensuring parity in unsubsidized loans. And what that looks like is advocating for equal loan limits for PA students. Each equal loan limits ensure fair access to education and promotes the equity that we talked about. And that equity is providing for people what they need where they are, as opposed to just doing a blanket spread for one profession or another. We also look at aligning loans limits with other healthcare professions. And this really does help to break down barriers for those who want to become PAs. Because when you have these other professions that have these opportunities and these limits as far as loans that are a lot higher, then people may be more inclined to go towards that profession. So given equity in these professions, these healthcare professions, can allow students, future students, to be able to decide where they want to go, what career they truly want to be in, and not let that financial burden or limits to finances be a barrier. And then educational equity necessitates equal opportunities and funding. And that fairness also, again, goes back to diversity I mentioned before, and access for healthcare professionals to be able to go back to their communities. And that's really what we want to see. People come from these communities all across our state, go back to those communities and provide healthcare. Our next recommendation is protect access to Grad Plus loans. You've heard a bit about the Grad Plus loans from Dr. Gianelli. That is one of the key things. It's a gap between what you can get in unsubsidized loans and what you need in order to be able to pay for school. And as you saw the example that Dr. Gianelli gave, there's a PA education is expensive. Risk of limiting access to Grad Plus loans will greatly hinder the ability for people who can't afford to pay out of pocket or cash or have family members to support them, or maybe not qualify for private loans. This is that one tool that's going to be helpful to keep those who want to be PAs or want to be in healthcare and want to provide for their communities they came from in our programs and in our schools. It will have a negative impact on diversity and inclusion in PA programs. These loans, if they're restricted, they can deter disadvantaged and unrepresented students from pursuing PA education. One of the things that our program does is really look at what are barriers to admission for students. And we look at many facts, and what it really boils down to is financial ability to be able to get into our program. So we really pay attention to what tuition is and try to keep tuition costs as low as possible to allow as many people in Arkansas where we are to be able to apply to PA school. Eliminating that or reducing grad plus loans is going to make a significant impact on the diversity that we have in our programs, as well as with underrepresented minority students, as well as disadvantaged students. They come from a background where they're first-time college grads and their parents and their family members never really even understood, I won't say understood, didn't want to understand the importance of it, but never had the opportunities to go to college themselves. So this gives them that ability to do that. And it also decreases workforce availability in healthcare. We don't want to see, one of the big things that we are proud of as PAs in our profession is that we go out into those rural areas. We work in those rural areas along with physicians and try to make a difference. If we don't have these types of loans available, it's going to reduce the number of PAs you see working with physicians and other health providers in those areas where they're needed the most. Our next policy recommendation is protect public service loan forgiveness and National Health Service Corps. Extending public service loan forgiveness programs will incentivize healthcare professionals to work in those areas that I just mentioned, these underserved areas, and improving the access to care. That is one of the biggest challenges we have in Arkansas, and I know many other states around this country has, is that access to good quality healthcare. PAs provide that as a profession. We go out to those communities, but the less ability we have to do these reduction and in these programs like the NHSC, the less we'll be able to be out there and help those people that are, again, are most in need. Also, continue the National Health Service Corps program. Continuing that is going to help us to focus on preventive health care. And I truly believe, after my time in the military as well as in the civilian sector, preventive health care is a key component to a healthy population. And if we can ensure that the National Health Service Corps focus in their guide is on prevention, and that's one of the main reasons, not only because it helps to pay back loans or to give students financial assistance, but it also helps to understand what that preventive health care is when they go out and serve in the National Health Service Corps. The other ask is the struggle for financial assistance. Oh, well, this is an ask, actually. I want to wrap this up and actually give you a perspective that I recently came across one of our students. Like Dr. Gianelli mentioned earlier, we have times when we meet with our students and talk about challenges that they deal with. I had one of my students that come to me who is my advisee, and she had a struggle that she was dealing with. We'll call her Jane Doe, just for privacy's sake. She's a good student in our program, first-year student. She manages a demanding life of being a full-time student, a mother to a teenage boy, and her husband is working and he's supportive of her making the sacrifice to not be able to provide financially for the family that she had before. Now, the challenge is, despite their income, she was ineligible. She applied for state financial assistance because the bills just weren't meeting with the loans that she had available that provided any type of stipend in her husband's income, because 50% of their income had just been cut out by her starting PA school. She applied to Arkansas's financial assistance program, but was denied because Arkansas, like many states, have a work requirement. So because she was not working, because our program is basically a 8 to 5 every day, and there's no time to work. When you're not in class, you're studying for the next exam, and there's usually 2-3 exams a week at times. And so it's a very demanding thing that we do not allow students to work. And because of that, one of the avenues that she was trying to seek for help wasn't available to her. Next slide. So what impact that had on her? With no access to those subsidized loans and denial of state support, our student Jane faced really significant financial stressors. Her only recourse, and I helped by providing as much information as I can, was to apply for as many scholarships as she possibly could. And so she had a whole list of scholarships she was applying to, and that was one of the reasons she reached out to me as well, was to ask if I would write a letter of support for some of these scholarships. And of course I did, and I gave her a list of other ones, but that's going to take time. It takes time to write out these scholarships. It takes time to write these letters as to why you are the most deserving of a certain scholarship, and that's pulling away from her family time as well as her study time. And that's just something that should not happen. So the call to action is, her story, it underscores an important and critical need to restore access to subsidized loans for PA students, as well as protect the protection and equity of current loans and loan forgiveness programs. Without this type of support, it will not allow students to thrive, and not just thriving academically, but personally with all of the things that goes on. Because one of the things that I've noticed, especially students with families, is what's going on in their family dynamics, their family challenges, has a direct effect on their ability to do well academically. And if we can help students by providing these types of systems of support, we can make a big difference in not only the students today, but that healthcare provider 2 years from now when they graduate. That is all that I have. I am going to thank you for your time and your attention to this. I'm going to turn it back over to Mr. Tyler Smith, and he will facilitate any questions that you all may have.
Absolutely. Well, thank you all so much for sharing your perspectives and for sharing your excellent presentations. So like we said, we're now going to transition to the Q&A section. So if you have a question you'd like to ask of any of the panelists, feel free to enter it in the Q&A box. There are a few questions that I wanted to use to just kick off the conversation. And I know, a common thread throughout a lot of the presentations today has been this issue of the cost of health professions education, and why it's so critical to preserve access so that students are able to finance their education and then go on to serve their communities. But I did want to just kick it off by digging a little bit deeper into costs specifically, because that's a question that we get from lots of congressional staff. So I'll open this up for whoever might want to jump in. I assume many of you might have common challenges at your programs. So what do you all see as some of the most important cost drivers leading to higher tuition in health professions?
Well, since I just spoke, I guess I can jump in and take this one, and definitely have anyone else that wants to add something to what I said. Every year we have to go through our budget and our finances and look at what we are charging for tuition and what additional resources that we provide the students that they pay for through tuition. And as I mentioned earlier, we try to keep those costs at a minimum, but there are things that are somewhat outside of our control. And one of the biggest things that has a strong influence on tuition is clinical rotations. We have had the privilege so far of not having to pay for rotations. I don't want to say that too loud, but that I know has affected many other programs that do, because that has to be part of their tuition. So the more rotations they pay for, the more the student tuition becomes, and it can become astronomical as far as tuition, depending on, especially in certain areas of the United States, it's more expensive cost of living anyway, like California and New York. So that's one thing for sure, is the cost of rotations for students, but also other things that we utilize every day, like assessment tools, as well as our platform that we use to instruct our students on. Those things drive costs up, and again, it's a challenge to make that something that's feasible for students in our area. I definitely welcome anyone else to add to that.
While others are thinking, I'll just add to that, Dr. Williams, at the programmatic level, also just the ability to recruit and retain good faculty, also reflects and impacts tuition in the health professions programs.
I think they nailed it. I'm not sure I have anything else to add to that.
Well, Frank, I actually might come to you in that case for the next question that we have here. And I know, Jacob, you spoke a little bit about this in your session too. over the past several years, we have seen, as Congress has considered different reforms that could be made in higher education policy, some proposals to roll back programs like Grad Plus to cap graduate borrowing at a lower level than it currently is, which places health professions education, which typically has significantly higher costs at significant risk. So can you speak to some of the adverse effects that you would anticipate if access to federal student aid was rolled back?
Yeah, I think there are two principal complications that could come from that. And both are beyond, as I mentioned, the individual burden. One is I think you get a lot less folks applying to health professions programs, specifically PA school, right? We heard from Mr. Jin, his story, and how without these loan options, you don't get folks applying to these programs. The cost is too high to attend, right? And so this is a must if we want to continue to have a diverse workforce with varied backgrounds that can meet the needs of diverse population. That's a must. The second thing is I think you really are going to see an additional strain put on the primary care system that we know already exists, particularly in rural and urban areas, get even worse. Folks will have less options in terms of where they can go for jobs that will meet the financial realities of this debt. Both myself and Dr. Williams spoke about our experiences in various ways of paying for PA school through different federal programs, his through the military, mine through the National Health Service Corps. And that's with these programs in place. If you remove things like Grad Plus, if you don't consider things like, increasing access to Stafford loans, subsidized Stafford loans and raising, the unsubsidized rates to be on par with our peers, that's going to exacerbate itself even further so. And so this is not just a potential career choice problem for an individual. Our entire country suffers when these things go away in lots of different ways, particularly with access to care, which is something that's on many of our minds right now.
Yeah, I just kind of want to add in that, like, just from a student perspective, just like, I know right now, me and a lot of my peers, as we are heading towards clinical year and then towards graduation, a lot of the discussion is like, how are we going to pay for our loans and what type of jobs will allow us to kind of relieve us from these loans as well. And so like that really does dictate like, you know, from someone going from into primary care or going to a rural service, just because maybe, you know, they're not paying as well as something in the city where it's just where they have like these where there's more job options, right? And so that's kind of a struggle for a lot of us as students, and we're just kind of struggling with how we balance like where our passion is with like our financial future as well.
All right. So next question, how do graduates of health professions programs compare to non-health professions programs in terms of debt repayment? I know that, there's a lot of focus on, growing balances of student loans and the ability of graduates to pay that back. So a question that we often get from staff that we're talking to on the Hill is, like, what does your profession look like in that regard? So does anyone want to speak to that?
I can mention, I could talk a little bit about this. We have, as PAs, we're in a fortunate position to have very healthy job options, healthy salary repayment options. We're in demand. I mean, that's not something that I'm making up. I mean, US World News Report has us regularly ranked as highest, in demand jobs, best jobs in healthcare, things of that nature. And so default rates are quite low in our professions. And so, any sort of raised cap, concern about defaulting, not repaying, I think is a little antiquated. And so we have, this real opportunity here to strengthen our workforce, strengthen the health of our workforce, the diversity of our workforce, the well-being of our workforce by supporting our students up front. And then students who come out not with this stress, not with this burden, with jobs that can repay them, will really create the type of workforce that will benefit our entire healthcare system.
And if I can add just a bit to that, and I don't mean to sound like I'm selling the PA profession here, but I will say that one of the most unique aspects or parts about our profession is that it's the flexibility of our graduates to be able to work in any healthcare field or area or discipline after graduation, and actually changing that career field as they go. For example, if a person graduates and they're single and they're on their own, they love in life, they may get a job working in surgery, working 40, 50, 60 hours a week. And they're happy with that. But if they meet someone, they get married, have kids, and that lifestyle has to change. And so they can't go right into working in, say, like family medicine without going back to school for a residency or a fellowship and incurring more debt. And so that ability for them to have the flexibility in our profession allows them to be able to target, I need to pay off my bills now. I'm going to work in this job that pays me really well. But once I pay that off, then I'm going to get into a job that's going to be conducive to family life. And that is such an easy transition in the PA profession when you compare that to nurse practitioners or physicians who would have to go back to school in order to change the discipline they work in. So I think that's a key component when it comes to financial burden and where and how long a person works in the inner city versus, say, in the rural area.
Absolutely. Okay. I got two more questions messaged to me. So the first is targeted towards the faculty. How do your programs encourage students to take advantage of available loan repayment opportunities after graduation?
So there's two things that we do. So one is we have a pretty we have a financial exit program that we do for our clinical phase students that occurs during the last semester of school, where we talk about different options that exist: National Service Corps, public loan forgiveness, military options, et cetera, that really help students to understand. We have financial counselors come in and really talk about different options that students have so that they understand what it is that they're going to. And then we try very early on to make our students aware of different faculty members that we have. We have faculty members who served in the military, faculty members like myself and another colleague of mine who were in the National Service Corps. And we pair students up early with folks that have similar interests and similar experiences so that we can communicate early on. Because as was mentioned, by the time folks are graduating, they're sort of on this idea of where they need to go because of these burdens. And so, this is something we try and start to address early on in PA school, not just in the 11th hour. So that's some of the ways that we've addressed it in the past.
Agreed. Our process, or my process in the past, has been similar, and we start socializing the idea of loan repayment, National Health Service Corps, military, even as we're recruiting students into the program, so that they can already be thinking about those as potential options.
I'll add just briefly, one of the things that we also do, along with what Minnie said already, as far as having those classes on National Health Service Corps, and then near the end in the clinical phase, we actually have like a financial planner that comes and talks to the entire class that's about to graduate and gives them some perspective of, here's the kind of money you're going to have, here's what you should be doing to plan for your future. And it also includes opportunities like we have a little health fair where different people from the military and other career fields will come in and give them insight on what a career in that particular area as a PA would look like and how it can financially help them.
All right, and then it looks like we have time for just one last question that goes to Jacob. So the question is, what is the number one thing that you believe policymakers could do to encourage more students to want to be health professionals?
Yeah, I think it's kind of giving people access to increase the access of especially financial access to be able to go into fields like medicine and being a PA. I mean, it took me a very long time to like really make that step forward just because of like the heavy investment of just, for me, just kind of establishing the career that I had previously into like entering a new entire different career where my passion was to like, be in medicine and helping others in that capacity. And so like, you know, it does, I think a lot of people in my shoes or kind of face that dilemma. And to be able to have that financial incentive and also a way to pay that back afterwards will create a more diverse workforce for people like me and people with similar backgrounds like me.
Absolutely. Absolutely. Well, with that, it looks like we're at our time for today. So I want to thank each of you for participating in today's briefing, as well as for all the attendees, both live and who will be watching the recording later. If you have any questions on PAEA's advocacy efforts, please don't hesitate to reach out to me at tsmith@paeaonline.org. We will be distributing a recording as well as the slides for this presentation later today. So, from all of us at PAEA, thank you again for attending, and we'll see you next time.